the following video, we will be explaining the importance of the refractive surgery program in the military, discussing the different types of refractive errors, and the risks and benefits of the different treatments available. Lastly, we'll discuss important considerations for service members undergoing refractive surgery. Military service members must rely on their vision to safely and effectively complete the mission. Glasses can be very effective at correcting vision in many situations, but the military environment can stress their capabilities. Glasses can slip or fall off, and often they interfere with proper fitting of personal protective equipment or tactical gear. Glasses are also prone to smudging or fogging, and may collect dirt or water droplets, which can drastically reduce vision and expose the service member to harm. Contact lenses can mitigate some of the issues presented by glasses, but are not authorized for use in austere environments or on deployment due to risks associated with prolonged wear or improper cleaning and handling techniques. The military refractive surgery program's goal is simple: to improve readiness by reducing or eliminating the need for glasses or contact lenses. Before we talk about the different types of refractive surgery, it's helpful to understand what it is we're treating, which is something we call refractive error. So, what is refractive error? Simply put, having a refractive error means your eyes are out of focus. There are four main categories of refractive error: myopia, hyperopia, astigmatism, and presbyopia. We'll briefly talk about how the eye works and why some people have refractive errors. The eye functions by converting the energy from light into electrical signals, similar to how a digital camera works. Light rays enter the eye through the cornea, pupil, and lens. These structures help to focus light onto the retina, the light-sensitive tissue lining the back of the eye. The retina transforms the light into electrical signals that it sends to the brain via the optic nerve. The brain then processes these signals to become the images we see. Myopia, or nearsightedness, is where the distance between the cornea and the retina is too long. Light rays focus in front of the retina instead of on it. With myopia, close objects will look clearer, but distant objects will appear blurred. Hyperopia, or farsightedness, is where the distance between the cornea and the retina is too short. Here, light rays are focused behind the retina instead of on it. Distant objects will look clear, but close objects will appear blurred. Astigmatism is when the cornea is unevenly curved. Usually the cornea is round like a basketball, but with astigmatism, it is more oval-shaped like a football. Light passing through this unevenly shaped cornea is not properly focused on the retina. Distance and close vision may both appear blurry. Presbyopia is a condition that occurs due to age-related changes in your eye. The lens becomes stiff and unable to change its shape to allow it to focus on closer objects. This change occurs slowly over time, but typically becomes noticeable in your early to mid-40s. People affected by presbyopia usually have to wear reading glasses to be able to see up close, though people with myopia may be able to see up close without glasses. Here is a list of commonly used methods to treat refractive error. We've already discussed glasses and contacts. In the next few slides, we'll give a brief overview of the different types of surgeries used to treat refractive error. It is important to know that not all service members are a candidate for every type of surgery. Your doctor will inform you which types of surgeries you qualify for. Corneal-based laser refractive surgeries, which include LASIK, PRK, and SMILE, change the shape of the cornea to help properly focus light onto the retina. Later on in the video, we'll discuss the slight differences between LASIK, PRK, and SMILE. An implantable Collamer lens, or ICL, is a foldable lens that is implanted inside your eye in front of your natural lens to help properly focus light onto the retina. In a refractive lens exchange, or RLE, your natural lens is replaced with an artificial lens to properly focus light onto the retina. RLE and ICL surgeries are both a type of intraocular surgery, meaning that surgery is performed inside of the eye as opposed to on the outer part of the eye, like with LASIK, PRK, or SMILE. While the overall risk associated with intraocular surgeries is still low, it is considered higher when compared to corneal-based laser refractive surgery. For this reason, most service members will receive either LASIK, PRK, or SMILE, and these surgeries will be the focus of the remainder of this video. If it is determined that you are not a good candidate for corneal-based laser refractive surgery, your doctor will discuss these other surgical options to you in more depth at a future appointment. LASIK, PRK, and SMILE all have the same effect, which is to change the shape of the cornea. For our purposes, there are two main layers of the cornea. The first is the epithelium, which is like the skin of the cornea. Below that is the stroma. Just like the skin on other parts of your body, the epithelium of the cornea can heal itself when injured. For this reason, laser treatments in this layer would be ineffective since the epithelium would repair any changes made by the laser. To achieve long-lasting results, the laser must change the shape of the stroma. The way the stroma is accessed is the main difference between LASIK, PRK, and SMILE. With all laser LASIK, your surgeon uses a laser to create a flap that contains the epithelium and the top portion of the stroma. This flap is gently unfolded, exposing bare stromal tissue beneath. The surgeon then uses another type of laser to remove the precise amount of corneal tissue needed to correct your vision. The flap is then folded back into its original position, where it heals naturally in place. In PRK, the epithelium is removed by the surgeon prior to the laser treatment. This is usually done with an electric brush, but it may also be done with an alcohol solution or other specialized surgical instruments. Once the epithelium is removed, the surgeon then uses the same laser that is used for LASIK to remove the precise amount of corneal tissue needed to correct your vision. Once complete, a bandaged soft contact lens is placed to protect the eye and to provide comfort as the epithelium heals naturally. This process usually takes several days, but may take longer in some cases. In SMILE, the same type of laser that is used to create the LASIK flap is used instead to create the precise three-dimensional shape that needs to be removed from your cornea to correct your vision from within the stroma. This shape is called a lenticule. A small access tunnel is also created by the laser so that the surgeon may dissect and remove the lenticule, leaving the cornea in the desired shape. Because there are small differences between how LASIK, PRK, and SMILE are performed, you may be wondering if one type of surgery outperforms the rest, and the short answer is no. All three surgeries have similar, excellent outcomes when it comes to final visual acuity, with over 99% of patients achieving 20/40 vision or better without glasses in multiple DoD studies, and 99% of patients report being satisfied with their surgery regardless of the type of surgery performed. However, there may be reasons why someone may want to choose one surgery over the others, and that has to do with the risks associated with the surgeries. Laser refractive surgery, like any surgical procedure, has risks. Fortunately, the likelihood of developing a serious complication is very low. Because LASIK, PRK, and SMILE are very similar, they share a number of the same risks, but there are slight differences between them. Eye pain is a common complaint after laser eye surgery. Eye pain usually starts once your numbing drops have worn off, which is typically around the time you arrive home after surgery. With LASIK and SMILE, this pain is often mild and lasts only a few hours. With PRK, however, it is common for patients to experience moderate to severe eye pain while the epithelium is still healing, which can take several days or longer in some cases. Regardless of the type of surgery, you will be given pain medications to help manage your symptoms. Additionally, frequent application of ice packs over closed eyelids for 10 minutes up to every half hour, as needed, will also help to manage your symptoms. Dry eye symptoms, including burning, gritty sensation, blurry vision, and tearing, are very common and should be expected by everyone undergoing laser refractive surgery. Recovery from these symptoms varies from patient to patient, but typically lasts a few weeks to a few months. Most of the time, patients report their dry eye symptoms eventually return to pre-surgical levels. However, at 1 year after surgery, about 5% of patients report that they have more dry eye symptoms than they had before surgery. Many of these patients who report persistent dry eye symptoms state symptoms are manageable and would still choose to have refractive surgery again. Less than 1% of patients report having dry eye symptoms severe enough that they regret having surgery. In many studies, SMILE patients reported less dry eye symptoms, particularly early on after surgery, when compared to LASIK. Frequent application of artificial teardrops after surgery will help to reduce dry eye symptoms. Do not wait for your eye to feel dry before putting in the artificial tears, as the corneal sensitivity to dryness may be diminished while the eye is recovering from surgery. Glare, halos, starburst, and ghosting are commonly reported visual disturbances even in people who haven't had any surgery, but are more common after surgery. Like dryness, One or more of these visual symptoms should be expected by all patients in the days to weeks following laser eye surgery. These symptoms lessen with time and often resolve completely. Less than 5% of patients report that these symptoms are bothersome beyond 3 months after surgery. Corneal ectasia is a disease in which the cornea becomes thin and bulges slowly over time. This can lead to an irregularly shaped cornea that causes blurry vision that can no longer be fixed with glasses and may require hard contact lenses or cornea transplantation to achieve clear vision. The most common form of ectasia is called keratoconus, and people who have a family member with keratoconus or frequently rub their eyes may be at an increased risk for developing keratoconus. Some people may have the risk for keratoconus or even a very mild form of keratoconus, but may not have any visual symptoms yet. If refractive surgery is performed on these individuals, it can cause their ectasia to progress. Because of this, ectasia is estimated to develop after laser refractive surgery in approximately 1 in 3,000 cases. Screening will be performed prior to surgery to determine if you have an increased risk for developing ectasia. If there are abnormalities suggestive of keratoconus, your doctor will inform you that you are not a good candidate for laser refractive surgery. It is thought that larger laser treatments carry an increased risk for inducing ectasia because they remove more corneal tissue. In some cases, your doctor may recommend PRK or SMILE rather than LASIK because they leave more intact cornea behind, which may reduce the likelihood of developing ectasia. Haze is an atypical healing response after surgery that results in cloudiness of the cornea. Most of the time, the haze is minimal and patients are unaware that it exists, but in some cases, it may be severe enough to cause glare and impair vision. Haze development typically peaks in the first few months after surgery and dissipates with time, but in rare cases, it may develop several months after surgery and can be persistent. Due to the mechanics of corneal healing, haze development is much more common with PRK than with LASIK or SMILE. However, even with PRK, the risk of developing visually significant haze is less than 5%. Because of this increased risk, patients who undergo PRK are prescribed a longer course of steroid eye drops after surgery to help minimize their likelihood of developing haze. A medication called mitomycin C may also be given at the time of surgery to patients undergoing PRK, as this is believed to help reduce the risk of haze development. Risk factors for haze development include young age, ultraviolet light exposure, and larger treatments where more tissue is removed from the cornea. With all laser LASIK, the flap heals naturally in place, creating a strong bond that is durable, similar to how cuts on other parts of your body heal. That said, in the first few days after LASIK, before the flap is fully healed, flap dislocations can still occur, especially if you rub your eyes. If the flap moves significantly, it may induce wrinkles in the flap called stria that can distort your vision. It may also create a pathway for surface epithelial cells to migrate underneath the flap, a condition called epithelial ingrowth. Additionally, inflammatory cells may accumulate underneath the flap even in the absence of a flap dislocation. Additional surgery may be required to reposition the flap or remove any unwanted cells to help restore vision. Although SMILE does not have a flap like LASIK, a pocket within the cornea is created that could also be susceptible to epithelial ingrowth or accumulation of inflammatory cells, but the risk of these with SMILE is lower than the risk with LASIK. Fortunately, the likelihood of any of these conditions having a lasting impact on your vision in either SMILE or LASIK is less than 1%. In order to make the precision shape required for a LASIK flap or SMILE lenticule, the eye is coupled to the laser by a single-use adapter that applies a small amount of suction to keep the eye in place while the laser completes its treatment. The eye is numbed with drops before this takes place, so you do not feel any discomfort during this step. While the suction can prevent most eye movements, it can be overcome with forceful or sudden eye movements. If suction is lost while the laser treatment is underway, it could impact the remainder of the surgery. For this reason, it is important that you relax your eye and remain focused on the flashing light in your field of view for the duration of the treatment, which is usually less than 30 seconds per eye. Most patients do very well with this step, but individuals who are extremely anxious may find PRK easier to tolerate. Infection is another rare but serious potential complication after laser refractive surgery, occurring in less than 1% of surgeries. To help reduce the risk of developing a surgical site infection, you will be prescribed antibiotic eye drops for use after your surgery. Keeping the eye clean after surgery by making sure that you wash your hands before instilling drops or touching your face will also help to reduce your risk. Additionally, avoid exposing your eye to substances that may be carrying pathogens, such as tap water, pool water, or sweat for the first few weeks after surgery. Lastly, although not a risk of refractive surgery, It is important to remember that presbyopia, or the need for reading glasses as you get older, happens to everyone, including those who have had laser refractive surgery. This change typically happens in your early to mid-40s. If you are over the age of 40 and do not currently wear reading glasses or bifocals, it may be because your current refractive error is masking these symptoms, and undergoing laser refractive surgery may uncover these age-related changes. Also, remember that your glasses prescription may change with time, so there may be a need for glasses or a touch-up surgery in the future to help achieve your best vision. This is a chart summarizing the respective benefits of PRK, LASIK, and SMILE. As previously mentioned, all three surgeries can produce excellent vision with extremely high rates of patient satisfaction, but each surgery has its strengths and weaknesses. With both LASIK and SMILE, there is usually minimal postoperative pain, and patients typically see clearly within a few days after surgery, making these surgeries the best choice for patients who want quick results or are worried about postoperative pain. For patients who are concerned about issues related to a LASIK flap, SMILE or PRK can be a good option. For patients with pre-existing dry eye or concerns about dry eye symptoms, SMILE may be the best choice. For patients who have a difficulty following instructions or keeping their eyes still during surgery due to anxiety or other medical conditions, PRK may be the best surgery because there is no risk for suction loss and lower rates of intraoperative complications. While ectasia can occur with any refractive surgery, SMILE and PRK are thought to have a lower risk for development of ectasia because SMILE spares the strongest parts of the cornea and PRK affects a lower overall amount of the cornea. Because of this, your doctor may recommend one of these types of surgeries rather than LASIK. Here is a similar chart highlighting the potential downsides of PRK, LASIK, and SMILE. All three surgeries have similar rates of infection, under or overcorrection, and visual disturbances such as glare, halos, starburst, and ghosting. While all surgeries may cause eye dryness, multiple studies suggest that patients who undergo SMILE may have a shorter duration of dry eye symptoms. PRK patients have substantially greater amounts of pain after surgery, and it typically takes longer for them to achieve clear vision after surgery when compared to LASIK or SMILE. People who have PRK are also at higher risk for recurrent erosions or haze formation. While all laser LASIK has an extremely low risk for flap dislocation in the long run, flap dislocation can still happen early on after surgery. The LASIK flap may also be susceptible to epithelial ingrowth or inflammation. These risks are less common with SMILE and non-existent with PRK. The lasers used in LASIK and SMILE require suction to the eye, and therefore also require a greater amount of patient cooperation to avoid intraoperative complications. Lastly, people who are hyperopic or farsighted are not candidates for SMILE. Additionally, there is a risk for retained lenticule fragments with SMILE. This risk may be slightly higher in patients with low refractive errors. By instruction, personnel in the Navy and Marines are required to have at least 12 months of remaining time on active duty at the time of surgery. Army and Air Force require a minimum of 6 months. For proper postoperative observation, patients should remain in the region for a minimum period of 1 month after surgery. Candidates with pending adverse personnel actions or those on limited duty or pending a medical board are not eligible for refractive surgery. Candidates must also have an approval form signed by their chain of command in order to have surgery. If this form is not received on the day of your surgery will be canceled. Patients should have no planned deployment for 3 months after PRK or 1 month after LASIK, SMILE, ICL, or refractive lens exchange. It is recommended that there be no commercial air travel or travel outside of the region for a period of 1 week after surgery. Remember to use all medications exactly as directed after surgery and avoid rubbing your eyes for 1 month after surgery. To prevent inadvertent eye rubbing, an eye shield will be given, which is to be worn while sleeping for 1 week after surgery. To help reduce the risk of haze development, PRK patients should wear 100% UV protection when outdoors. You will need a ride on the day of the procedure and your first post-op follow-up visit. If you need to cancel one of your post-op visits, please be sure to reschedule this appointment as soon as possible. Don't just skip appointments. Light individual PT can resume after 1 week and group PT after 2 weeks. To avoid getting water or sweat in your eye, refrain from swimming, contact sports, or field exercises for 1 month after surgery. Patients who receive PRK are given a bandaged contact lens to help reduce post-operative discomfort. This lens will be removed at the doctor's office, usually at your 1-week follow-up appointment. If your lens accidentally falls out before then, discard the lens. Do not attempt to replace it on your own. Loss of the bandaged contact lens is not an emergency, and the eye will still heal properly without the contact lens. If the eye is too painful without the bandaged contact lens, you may call the refractive surgery clinic during business hours to have it replaced. If you have no discomfort when the contact lens falls out, this typically means your eye is already healed and there is no need for the contact lens anymore. Simply leave it out and mention it at your next scheduled post-operative appointment. Remember to remain out of contact lenses before your pre-op evaluation for a period of at least 2 weeks for soft contact lenses and 4 weeks for hard or toric contact lenses. Contact lenses can subtly change the shape of your cornea, which could affect preoperative measurements and lead to an under- or overcorrection. We hope you found this video helpful. If you have any questions regarding your upcoming surgery, please do not hesitate to ask the refractive surgery team during your upcoming appointment. We know your vision is important, and we are committed to helping you improve your sight.